Good morning.
Good morning.
How you doing?
I'm awesome.
I'm doing awesome. How are you guys doing? Okay, come on. How you doing?
How about that last fireside chat, guys? Huh?
Gateway drug to YouTube.
I highly recommend that you go check out Z-Dog's videos if you haven't seen those, and I highly recommend that you check out Marty's book as well. It is a real game changer, and it's very disruptive in a very positive way. Anyway, little editorial there.
Agreed. And so today we're here to talk about something that is really quite important and very frequently surprising. So when we say chronic disease in America, most people immediately think of diabetes, heart disease, and increasingly cancer, as people are living longer with cancer. And even though 1 in 7 Americans are living with kidney disease, and it's the 9th leading cause of death in America, we rarely talk about kidney diseases. So why is that, Ed?
Well, that's a great question, and that's something that we spent a lot of time thinking about. 1% of the entire federal budget every year. Marty was just talking about different percentages of the federal budget that go to pay for health care. 1% of the entire federal budget every year goes to pay just for dialysis treatment in the United States. The reason is because most dialysis is provided by CMS, through Medicare. And that's more than that's more money than the entire budget for NASA and the Department of Commerce combined, just as an example, just to kind of put it into context. And we have seen no innovation in this space, especially around dialysis, since President Nixon in 1972 signed the end-stage renal disease bill that allowed people access to dialysis through Medicare. So number one, I think we got complacent and comfortable with the system that was providing care. And listen, dialysis was a miracle therapy for its time, but it hasn't changed in 60 years. The underlying technology is exactly the same. We've miniaturized the machines a little bit. We've added some new filtration technologies and things like that. But to get back to your question, why is it that we don't hear a lot about kidney disease when it's the 9th leading cause of death in the United States? And I think there are a few reasons. Number one, it's downstream from a lot of other chronic conditions. So basically, cardiac issues and diabetes contribute quite a bit to kidney diseases. And when we say kidney disease, understand that there are preventable chronic forms of kidney disease, but there are also other causes, genetic causes to kidney disease as well, and we don't want to lump them all together. But a significant portion of kidney disease is downstream from cardiac issues and type 2 diabetes. And so that's why I think it doesn't get as much attention. Another reason it doesn't get as much attention is because it's because of the way that we've paid for it in the past. People don't have a lot of visibility to that. You know.
Well, that's going to change.
It is.
So
it is.
Last year, an executive order was issued to encourage people to start addressing this problem because now we have new tools and ways of working at hand. So can you unpack that for me a little bit?
Sure. So I'm proud to say that the president signed an executive order last year to address kidney care in the United States. It's called Advancing American Kidney Health. And just to give you a little bit of background and perspective on executive orders, so there have been approximately 15,000 executive orders in the history of the presidency, and there are 12 that are specific to healthcare. But this is the first executive order ever to take a comprehensive approach to solving a particular disease state or set of diseases. And we realized that we had a really big issue to tackle, and we needed to tackle it from kind of an ecosystem approach and look across the continuum of care, look at what patients go through, look at the state of the science, and most importantly for CMS and for HHS at large, look at how we pay for this care. So we're rolling that out now. We have new rules coming out through CMS. We have basically two rules. One is a mandatory rule, and one is an opt-in rule model. And the opt-in model has basically three streams of payment. I won't get into the nitty-gritty details on how that works, but understand that a lot of people are working very hard to figure out how to shift from paying for a unit of care to shifting to value to really positively impact patients. So there are really three parts. I just mentioned the new payment rules that are coming out. Another one is around prevention and awareness. So we have a real issue with primary caregivers in that while they do understand type 2 diabetes and they understand other well-known disease states, a lot of them don't quite know how to address kidney disease in its earlier stages. In fact, most of the time, people don't learn that they have kidney disease until around stage 4 of the disease, or actually when they go into kidney failure. So we have a lot of work to do to educate primary care, as well as educate patients so that they can become better advocates for themselves and more curious about what kidney disease means to them. So that's the second part. And then the third part is really around transplantation. So addressing how people are able to get organs. So dialysis, again, is great for what it is. It's a brutal therapy, but really the best therapy is a transplant. And so we have issues that we need to address there. We're wasting organs in the United States, for instance. The supply chain is broken. And a lot of this has to do with the government and rules. The way that we evaluate organizations that procure organs and deliver them to recipients, the rules are arcane and they're old, and they create disincentives, and they create a perceived risk among folks that are procuring those organs. So what we're doing here as part of the executive order is helping to de-risk de-risk the environment and get more organs to more patients. Right now, what we see is we're wasting a lot of viable organs every year, which means people aren't getting those. Another thing I'll say is that approximately 724,000 people have end-stage renal disease, and 100,000 people go on to dialysis every single year. And within 5 years, half of those people will be dead. So we really do need to focus on organs, getting more organs to people for transplant.
Yeah. So I'm going to lay this out very simply. New rules equals new opportunities.
Yes, absolutely.
Inventors, investors, the ecosystem at large can play. And this is very reminiscent of 10 years ago when StartUp Health was founded, and I remember that moment where the federal government did a lot of work to share with the community what is possible versus what is not possible. So I would take Ed's words to heart and know that there is a lot more that will be possible, but it will require you. So let's talk a little bit about the ways that people can engage and perhaps speak to KidneyX.
Yeah, so we heard from Unity today about the moonshot program, right? Multiple moonshots and then the principles that surround those moonshots. And KidneyX is really my office's moonshot and HHS's moonshot. I report to the secretary at HHS. There are 11 agencies within HHS. They include NIH, FDA, CDC, CMS, and so on. We realized that we had a lot of work to do around the kidney space. So we created KidneyX, and it's really our moonshot. And we modeled it off of the X Prize Foundation. So I'm sure all of you know the X Prize Foundation. The idea behind it is to raise money and give prizes out to drive solutions to intractable, pressing problems that humanity faces. And we thought that was a perfect model for us in this particular case. So we're starting with dialysis. I mentioned it's 1% of the entire federal budget, and I mentioned the issues associated with it. When I first got into this role, I had the opportunity to go meet with the White House Chief of Staff for Innovation. His name is Chris Liddell. He runs the Office of American Innovation. And I gave him my pitch deck for my office. Like, this is what I want to do. This is the value I want to drive for the American people, and how I hope that we can help people through innovation. And he, about halfway through, kind of closed it. And he said, hey, this is awesome. I understand everything you're doing here. I just want to ask you one thing. How are you going to help millions of people and millions of lives and or impact billions of dollars of taxpayer money? Because it's supremely important, and you need to wake up every day thinking about that. And that's exactly what we're aiming to do here with KidneyX. So KidneyX is a multi-prize project. We're starting with redesigned dialysis, and we've already given out 15 prizes of $75,000 apiece just for ideation, just surfacing ideas and beginning to build awareness and urgency and collaboration among innovators such as the folks in this room. The next phase of that is we're in the middle of that one, and that's our proof of concept phase. That's the bridge phase. As many of you are probably aware of that model. So we want to start to actuate these things. We want to see business models maturing and everything. So we're going to be giving away 3 prizes of $500,000 apiece in the second phase. And then the final is accelerating commercialization, and this is where we want to help people really coalesce, understand. We want to de-risk the environment for investment. We want to help people understand how they can commercialize their products, how to work with the FDA, how to work with CMS to get paid for your innovations, as well as what we know is that we're going to have people that have components of solutions. So we want to be able to help folks synthesize and combine their components of solutions to create a product in the end. And so that's kind of the motion we're going through, the flow of the prizes. So that's redesigned dialysis.
And you also engaged patients.
Yes.
Through the Patient Innovator Challenge.
That's something I feel very, very strongly about. So we need to understand what patients go through, right? So my office is responsible across HHS for human-centered design and design thinking, journey mapping, putting ourselves in the shoes of a user or a patient or a customer, and we can't be successful without doing that. So we kicked off another prize, and this prize is to award patient innovators who many of them sit in dialysis chairs for many, many hours a week, and they come up with hacks for their own care. They have thoughts. Hey, why does this device that's going into my arm look like this? It's painful and it's awkward. I think I could design something better. So we're working with patients and surfacing those ideas through that prize.
Well, that's what I love about this initiative is that it's an ecosystem play. And when we started working with HHS to support KidneyX, I was surprised at how many people didn't see themselves as part of the solution. And it boggles the mind. So whether you're a patient or a caregiver, a tissue engineer, data scientist, you probably have a way of contributing to KidneyX and ultimately to the solution.
Absolutely. And we know that ideas are going to come from many, many places. We're not even sure where they're going to come from, right? So we have, one of our prize recipients was a group of grad students at Stanford. And we also have seasoned scientists. We have nanotechnologists. We have people from really all walks of life. And I would encourage folks in the high-tech innovation space to think about your technologies, your services, your solutions in this context. Anybody in the room, think about what you do, and is there an adjunct available for helping us fix kidney care in the United States through KidneyX? The prizes are, you can go check it out and for yourself and see. You can get detailed information at kidneyx.org and see if some of your technologies would be useful.
Yeah. So maybe it's good to close on what's coming next. So you recently, HHS and KidneyX issued an RFI for the Artificial Kidney Prize. And can you comment on the scope and scale of what that might be as you're designing it right now?
Yeah, absolutely. So I told you about the executive order, and the executive order directly instructs us to go after an artificial kidney. And that truly is our moonshot. We know it's not going to happen overnight. We know that we have a lot of work to do to get there. But we have a plan. We have persistence, and we have the 8 C's that Unity spoke about. So we're pretty bullish about this. So what does success look like? What success looks like is creating a way for us to get people off of dialysis using an artificial kidney. That could be an implantable kidney, or it could be a wearable kidney. And again, we're also looking for components of a solution like that. It may not be either one of those things. It may be something completely different. It may be a new therapeutic. It may be something digital. Nothing is off the table as we begin to explore this space and put this prize together.
And whereas the previous challenges ran for a number of months, the RFI suggests that this might run for years.
Totally.
This might be, this is a true moonshot, and that the prizes would be commensurate with the type of effort one would need. So that's very heartening to hear, the long-range moonshot. So maybe in closing, where can people find more information about these challenges, about opportunities to engage with KidneyX?
Yeah, so look up KidneyX, kidneyx.org, and go to my website at HHS, so hhs.gov/CTO, to learn more about our programs. And yeah, please don't be a stranger. The government, your federal government is open for business. That's why I'm here today, is to tell you that. So all of you that, all of the investors in the room that have been reluctant to invest in these health startups, understand we're looking for ways to de-risk that environment. We want to make everybody successful. And for you innovators out there, understand that we hear you and we know what you go through, and we want to help you out.
So it's not only possible, it's imperative, and the government's open for business. Thank you, Ed.
Thanks so much.
Thank you so much.